Imagine recovering from major surgery faster with no complications, less pain, and even a shorter hospital stay. It sounds impossible? Not anymore. Thanks to ERAS. Welcome to Enhanced Surgical Care. Enhanced recovery after surgery is a game-changing, evidence-based approach that redefines how we manage patients before, during, and after surgery. It focuses on faster healing, reduced stress, and smarter coordination among healthcare professionals. Let's walk through the core components of ERAS protocol and how each step contributes to a smoother, safer recovery journey. Let's start with pain control. Effective pain management is critical. The goal is to minimize opioid use wherever, whenever appropriate, opting for safe alternatives. Nurses must review the pain management plan and administer multimodal analgesia accordingly, ensuring patients remain comfortable and pain-free. If needed, collaboration with the pain management team ensure the most appropriate and tailored approach for each patient. Prevention of surgical site infection. Infection prevention is another key priority. Nurses must assess for signs and symptoms of infection regularly and refer to physician when necessary. Hand hygiene is the key component of infection prevention and control. Always maintain aseptic technique during dressing changes and report any untoward observations promptly to prevent complications. Postoperative nausea, vomiting, ONV prevention. No one likes nauseous after surgery. That's why it's vital to continue antiemetic treatments as ordered, ensuring patients stay comfortable and can begin oral intake sooner. Early mobilization. One of the pillars of ERAS is getting patients moving early. Encourage patients to sit up, dangle their legs, and walk as tolerated. Administer pain medications in advance to make movement more manageable. For patients with an epidural catheter, encourage them to sit for a while and mobilize with assistance. Make sure to identify and provide any necessary assistive devices and refer to a physiotherapist when needed. Teamwork makes all the difference. Postoperative fluid management. Nutrition and hydration go hand in hand with healing. Encourage early feeding as tolerated and as ordered by the physician. If there are any concerns like vomiting, observe closely and refer accordingly. Collaborate with the dietitians to tailor the nutritional plan to the patient's recovery needs. Early urinary catheter removal. To reduce infection risk, encourage early removal of urinary catheters unless contraindicated. The duration should be individualized, particularly patients with risk factors, male gender, or any pelvic surgeries. Thromboprophylaxis. Preventing blood clot is essential. Use mechanical methods like well-fitting compression stockings or intermittent pneumatic compression devices until discharge. For pharmacological prophylaxis, follow evidence-based protocols like administering subcutaneous enoxaparin slowly 10 seconds in, then wait for 10 seconds before withdrawing the needle to minimize complications. Why ERAS matters? ERAS isn't just a checklist. It's a philosophy of care, and the result speaks volumes. Patient experience 30 to 50% shorter hospital stays, no complications, and faster return to daily life. By reducing healthcare costs and improving patients' outcomes, ERAS is redefining what recovery should look like. As a conclusion, ERAS is more than a protocol. It's a movement. It's about working smarter, healing faster, and placing the patient at the center of care. If you or a loved one is preparing for surgery, ask your healthcare provider about ERAS, because smarter care doesn't just save times, it saves lives.